There is significant patient burden in hemoglobinopathies. If I were to talk about sickle cell disease to start with, sickle cell disease is the most significant genetic disorder in the world. There are hundreds of thousands of patients being born with sickle cell disease world over, and it's also one of the most common genetic diseases inherited in children in the UK, for instance. The unmet needs are plenty, starts from birth almost to the end of life. Sickle cell disease causes significant reduction in the life expectancy, so people are still dying in their mid-40s. So although a lot has been done in pediatrics in making sickle cell disease a condition where almost everybody in the Western world or in healthcare system where there is good healthcare systems, children with sickle cell disease are surviving through to adulthood. But as soon as they enter into adulthood, things start falling apart. So in terms of sort of going through it from the basics, the unmet needs are worldwide. Probably we need to establish really good ways of screening sickle cell disease at birth, ensuring that patients are getting access to treatments such as penicillin, huge importance of hydroxyurea the world over, so I think it's really important that people have access to that, and physicians are able to prescribe it in the right way. We now know that hydroxyurea is very well tolerated, in maximum tolerated dose gives the maximum benefit. So that's something which is really important and currently still unmet in terms of access to that drug. When it comes to other kinds of unmet needs, it's very important to establish good transition of care from pediatric to adult services. There are more and more people surviving through to adulthood. When it comes to adulthood, it's important that we continue to monitor for organ damage and have as much access as possible to curative therapies, which essentially I think everybody really needs access to that. Right now, the barriers to that is cost and various invasive complications of that condition. So yes, many unmet needs, but we need to work towards making those happen. You also asked about what my key takeaways from the Congress. I guess in terms of sickle cell disease and thalassemia, there is a lot of very promising results in the sort of gene therapy space. So we've heard a lot about the phase 3 study on exocel, which has shown sustained, consistent, vaso-occlusive, crisis-free duration after 2 years of follow-up, which is really encouraging. We've also had other forms of gene editing in sickle cell, which has been presented this time. So the reni-cel data was presented, which is also very exciting to see. There are new molecules also being presented, such as the newer new generation voxelotor, essentially. That data was presented, and some other oral modifiers of sickle cell disease, such as there was one which was a hemoglobin F inducer, and the other one was essentially increasing iron by increasing this hypoxia inducible factor. So these are new drugs in the horizon, which are quite encouraging to see that things are being talked about. We talked a lot also about patient participation in research. It was quite nice to see what patients are talking about in the sort of facilitators and deterrents of participating in research.